You might have read recent evidence about ADHD increases the risk of Parkinson's disease. ASD increases the risk of Parkinson's disease. The odds are quite significant, more than double. The question is, here's another way of thinking about it. If we think about Parkinson's disease, usually onsets later. Many individuals with Parkinson's disease, as I mentioned, present with ADHD phenotypes early on because cognition is the initial expression of any sort of dopaminergic dysfunction. But in Parkinson's disease, the abnormality will be in the presynaptic space because we're actually having dopamine degeneration. In relation to ADHD, ASD, and Parkinson's disease, there are cohort studies suggesting that people with ADHD or ASD may have a higher incidence of Parkinson's disease later in life. But the data are still evolving, and there are confounding factors at play. Clinically, the useful point is this. Early dopaminergic dysfunction often presents with cognitive and sleep changes long before classical motor signs. So when we see an older adult with an ADHD phenotype, plus say REM sleep behavior disorder, constipation, or hyposmia, it's worth thinking beyond pure ADHD. So therefore, it's worth checking iron studies and treating deficiency alongside ADHD management rather than assuming that it's just the ADHD. So look out for these aspects because, sure, stimulants can be prescribed, but we also need to take into account what else is happening. REM sleep behavior disorder has a high association with Parkinson's, usually as a good clue to pick it up. And that's why PACEs can really help. So I have a patient that I'm managing with Parkinson's disease who's 72 now, but was diagnosed with ADHD 40 to 50 and was on medication. There's another important aspect in that presynaptic one, if I just come back, inflammation. Inflammation reduces iron. So inflammation reduces iron through acting at the presynaptic level. So you will see high rates of ADHD phenotypes in chronic fatigue syndrome, fibromyalgia, all inflammatory disorders. If you have individuals with rheumatoid arthritis, Crohn's disease, SLE, if you examine their cognition, they will tend to have an ADHD phenotype. Now, whether a stimulant works or not is a different perspective because there's several other things to take into account in inflammatory disorders. But look out for this. Similarly, obstructive sleep apnea reduces iron through the heightened, any inflammation does because there's greater levels of what's known as hepcidin, which reduces iron stores overall. So look out for any inflammatory conditions. ADHD phenotypes can be present within those conditions.